Have you ever wondered if the little changes in your body could be a sign of something more serious? If you're noticing unusual symptoms, could be more than just a passing discomfort. It could be your body signaling the early stages of diabetes. In this video, we're going to explore the 10 early signs of diabetes that many people overlook. Recognizing these symptoms early could make all the difference in preventing complications and leading a healthier life. Stick around and find out how paying attention to these signs could save you from serious health issues. As we age, our bodies go through natural changes, and it's easy to attribute some of these changes to simply getting older. However, many of the early signs of diabetes are subtle and can easily be mistaken for normal aging. That's why it's important to stay informed and vigilant. By recognizing these signs early, you have the power to take action before things get worse. 1. Unexplained weight loss. Unexplained weight loss is one of the early and concerning signs of diabetes, particularly when it occurs without any effort or change in diet and exercise habits. This phenomenon happens because the body is not able to properly utilize glucose, a type of sugar, for energy, often due to insufficient or ineffective insulin production. Insulin is a hormone produced by the pancreas that helps regulate the amount of glucose in the bloodstream. It allows glucose to enter the cells, where it is used for energy. When insulin is not functioning effectively, whether due to type 1 diabetes, where the body produces little to no insulin, or type 2 diabetes, where the body becomes resistant to insulin, the body cannot effectively use glucose for energy. As a result, it begins to break down fat and muscle tissue as an alternative source of energy. This process of breaking down fat and muscle can lead to noticeable weight loss, even when the individual is eating normally, or perhaps even more than usual. In addition to weight loss, this process can result in other symptoms related to the body's struggle to obtain energy from glucose. These symptoms can include fatigue, weakness, and increased hunger, as the body's cells are not getting the energy they need from glucose. People with diabetes may also experience dehydration, as the body excretes excess glucose through urine, leading to a frequent need to urinate, which further exacerbates weight loss. It's important to note that unexplained weight loss is not always indicative of diabetes alone. Other medical conditions such as hypothyroidism, cancer, or digestive disorders can also cause similar symptoms. However, if you are experiencing sudden or unexplained weight loss alongside other common diabetes symptoms, such as increased thirst, frequent urination, blurred vision, or slow-healing wounds, it is crucial to seek medical attention promptly. A healthcare provider can perform tests, such as blood glucose measurements and HbA1c tests, to determine if diabetes is the underlying cause of the weight loss. Early diagnosis and management are important to prevent further complications associated with diabetes. 2. Increased thirst. Constant thirst, regardless of how much water you drink, is one of the classic signs of diabetes. This sensation is medically referred to as polydipsia. It occurs when blood sugar, glucose, levels become elevated, a condition known as hyperglycemia. In a healthy individual, insulin regulates blood glucose by helping cells absorb it for energy. However, in individuals with diabetes, either the body doesn't produce enough insulin, as in type 1 diabetes, or the cells become resistant to it, as in type 2 diabetes. As a result, glucose remains in the bloodstream rather than being used by the cells, causing blood sugar levels to rise. The kidneys, which are responsible for filtering waste from the blood, begin to work harder in an attempt to remove the excess sugar from the bloodstream. In doing so, they also filter out more water, leading to increased urination, a condition called polyuria. This frequent urination causes dehydration because the body is losing more fluid than usual. To compensate for this loss, the brain signals the body to increase thirst in an attempt to replenish the fluids that have been lost. Despite drinking large amounts of water, the dehydration persists because the underlying cause, high blood sugar levels, is not addressed. This cycle of excessive urination and persistent thirst can lead to a vicious loop where an individual feels the need to drink constantly, but still remains dehydrated. Over time, this can cause further complications, such as dry mouth, tiredness, and a general feeling of weakness. If the elevated blood sugar continues unchecked, it can lead to more severe problems, including kidney damage, nerve damage, and other health issues. If you notice that you are feeling unusually thirsty, especially when accompanied by other symptoms such as frequent urination, blurred vision, or unexplained weight loss, it is important to consult a healthcare provider. Early detection and management of diabetes can help prevent these complications and improve overall health outcomes. 3. Frequent urination. Frequent urination, known as polyuria, is a common and often overlooked symptom of diabetes. When blood sugar levels are elevated, the kidneys are forced to work harder to filter out the excess glucose in the bloodstream. Under normal circumstances, the kidneys reabsorb most of the glucose back into the bloodstream, but when blood sugar levels exceed a certain threshold, the kidneys can no longer reabsorb all the sugar. As a result, the excess glucose is excreted through urine, which draws more water with it. This increased production of urine causes frequent trips to the bathroom, a condition that is particularly noticeable during the day, but can also occur at night, disturbing sleep. This nighttime urination is known as nocturia, and it can significantly affect a person's rest and overall quality of life. If you find yourself waking up multiple times during the night to use the bathroom, it may be a sign that your blood sugar levels are not properly regulated. During the day, the need to urinate frequently might cause inconvenience and disrupt normal activities, leading to a sense of discomfort or even embarrassment. However, this symptom often goes unnoticed in the early stages of diabetes, as people may attribute it to other factors like consuming more fluids or stress. The reason behind this frequent urination lies in the body's efforts to deal with the excess glucose. When glucose builds up in the bloodstream, the kidneys work overtime to filter it out, which increases the amount of urine produced. As this happens, the body loses a significant amount of fluid, leading to dehydration, which, in turn, triggers increased thirst. The cycle of excessive thirst and frequent urination can be exhausting and may worsen if blood sugar levels are not managed. If you notice frequent urination, particularly if it occurs along with other common signs of diabetes, such as excessive thirst, fatigue, blurred vision, or unexplained weight loss, it is important to seek medical attention. A healthcare professional can conduct tests to measure blood glucose levels and determine if diabetes is the underlying cause. Early detection and intervention are essential to manage blood sugar levels effectively and to prevent long-term complications such as kidney damage and nerve issues that can arise from untreated diabetes. 4. Fatigue. Feeling unusually tired or fatigued is a common and often early warning sign of diabetes. This type of fatigue can be different from normal tiredness because it's persistent and doesn't improve with rest. The root cause lies in the body's inability to properly use glucose for energy. In a healthy individual, insulin helps cells absorb glucose from the bloodstream, which is then used as a primary source of energy for the body. However, in people with diabetes, whether due to insulin resistance in type 2 diabetes or insufficient insulin production in type 1 diabetes, the glucose remains in the bloodstream instead of entering the cells. As a result, even though there may be an abundance of glucose in the blood, the cells are starved of energy. This energy deficiency can leave you feeling drained, sluggish, and unable to perform everyday tasks with the usual vigor. The fatigue can be both physical and mental, affecting your ability to concentrate and focus. In many cases, people with diabetes may also experience a sense of weakness or heaviness in their muscles, which can make physical activities feel more challenging. This feeling of exhaustion often doesn't resolve with sleep or relaxation, as it's linked to an underlying issue with glucose metabolism rather than just a lack of rest. Additionally, fatigue can be compounded by other symptoms of diabetes, such as dehydration, frequent urination, and increased thirst. As the kidneys work harder to filter excess glucose, more fluid is lost through urination, which leads to dehydration. Dehydration further contributes to feelings of tiredness, making it even harder for the body to function at its best. If you're experiencing ongoing fatigue along with other symptoms like excessive thirst, frequent urination, blurred vision, or unexplained weight loss, it's important to consult a healthcare provider. Persistent tiredness may be a sign of uncontrolled diabetes, and early detection is crucial for managing the condition and preventing more serious complications. With proper treatment, including lifestyle changes, medications, or insulin therapy, blood sugar levels can be regulated, leading to improved energy levels and overall well-being. 5. Blurred vision. Blurry vision is another common yet often overlooked symptom of diabetes, and it can occur as a result of fluctuations in blood sugar levels. When blood sugar levels are too high, they can cause changes in the fluid balance of the body, including in the eyes. The lenses of the eyes are made up of water, and when blood sugar levels are elevated, excess glucose can draw water into the eye's lens. This can cause the lens to swell, affecting its ability to focus properly. As a result, people with uncontrolled diabetes often experience blurry vision or difficulty seeing clearly, especially for close-up tasks like reading or focusing on objects. This blurry vision is typically temporary and can improve once blood sugar levels are brought under control. However, if blood sugar levels remain consistently high over time, the problem can become more persistent, and the damage to the eye could become more severe. Chronic high blood sugar levels can also lead to more serious complications, such as diabetic retinopathy, a condition that damages the blood vessels in the retina, or cataracts, which can cloud the eye's lens. Both of these conditions can lead to permanent vision loss if left untreated. It's important to understand that blurry vision related to diabetes should not be dismissed as a minor issue. While it may seem like a small inconvenience at first, it can be a sign that your blood sugar is not well controlled and may require medical attention. If blurry vision is accompanied by other common diabetes symptoms, such as excessive thirst, frequent urination, unexplained weight loss, or fatigue, it's essential to consult a healthcare provider. Early detection and management of diabetes can help prevent vision-related complications and preserve eye health in the long term. Regular eye exams are also recommended for individuals with diabetes to monitor for any early signs of diabetic retinopathy or other eye conditions. 6. Slow healing of wounds. Slow or delayed wound healing is a common and concerning symptom of diabetes that should not be ignored. When blood sugar levels are elevated, it can interfere with the body's natural healing processes, making it harder for cuts, bruises, and other wounds to recover properly. One reason for this is that high blood sugar levels can impair the function of white blood cells, which are essential for fighting infections and repairing damaged tissues. White blood cells play a key role in the immune system by helping to prevent and fight infections, as well as promoting healing. When blood glucose levels are too high, the efficiency of these cells is reduced, leaving the body more vulnerable to infections and slowing the healing process. Additionally, poor circulation is another factor that contributes to delayed wound healing in individuals with diabetes. Over time, high blood sugar levels can damage blood vessels, particularly the small ones, which can impair blood flow to various parts of the body. This reduced circulation means that oxygen and nutrients, both critical for tissue repair, are not delivered to the wound site as efficiently. As a result, wounds may take longer to heal, and the risk of developing an infection increases. Infections that develop around wounds can complicate the healing process, making the problem worse and sometimes leading to more serious conditions like gangrene if left untreated. Diabetic neuropathy, a common complication of long-term diabetes, can also contribute to slow healing. This condition causes nerve damage, particularly in the feet and lower limbs, which can lead to a loss of sensation. If a person with diabetic neuropathy sustains an injury or develops a wound, they might not feel the pain or discomfort, which can lead to delayed treatment. This lack of awareness can further increase the risk of infections and complications. If you notice that cuts, bruises, or other wounds are taking longer to heal than usual, especially if you have other symptoms of diabetes, such as excessive thirst, frequent urination, or blurry vision, it's important to consult a healthcare provider. Early diagnosis and management of diabetes are crucial to preventing complications, such as infections, ulcers, and even amputations in severe cases. By keeping blood sugar levels under control and maintaining good wound care practices, individuals with diabetes can improve their chances of faster healing and reduce the risk of further complications. 7. Tingling or numbness in hands or feet. Nerve damage or neuropathy is a common complication of diabetes that can significantly impact a person's quality of life. Over time, high blood sugar levels can damage the blood vessels that supply oxygen and nutrients to the nerves, particularly the small nerves in the extremities, such as the hands, feet, and legs. This damage disrupts the normal function of the nerves, leading to various sensations like tingling, numbness, or a burning feeling, particularly in the lower limbs. These sensations are often the first signs of diabetic neuropathy, and they can range from mild discomfort to severe pain, making it difficult to perform everyday activities. The symptoms of neuropathy tend to develop gradually and may be worse at night. In the early stages, individuals may notice a mild tingling or pins and needles sensation in their feet or hands, which may be temporary. However, as the condition progresses, the sensation can become more persistent and intense, sometimes leading to a feeling of numbness or loss of feeling in the affected areas. This loss of sensation is particularly concerning because it can make it harder to detect injuries, cuts, or blisters, especially in the feet. Without proper care, these unnoticed wounds can become infected and lead to more serious complications, such as ulcers or even amputations in extreme cases. In addition to tingling and numbness, people with diabetic neuropathy may experience muscle weakness, difficulty walking, and a loss of coordination. The constant discomfort and pain associated with neuropathy can also lead to sleep disturbances, depression, and a reduced ability to engage in physical activities. If you begin to notice unusual sensations in your hands or feet, such as tingling, burning, or numbness, it's important to see a healthcare provider for an evaluation. Early detection of neuropathy can help prevent further nerve damage and allow for the implementation of strategies to manage the condition. Effective management of blood sugar levels through diet, exercise, and medication is key to preventing or slowing the progression of diabetic neuropathy. In some cases, medications or therapies to relieve pain and discomfort may also be recommended. Taking action early can help preserve nerve function and improve overall quality of life. 8. Dark skin patches. Dark, velvety patches of skin, commonly found in areas such as the armpits, neck, or groin, are often an early warning sign of insulin resistance, a condition that can precede the development of type 2 diabetes. This skin condition is known as acanthosis nigricans, and it is characterized by the thickening and darkening of the skin in certain folds or creases of the body. The patches typically appear as a dark, velvety texture, sometimes with a slightly raised surface, and can range in color from brown to black. While these skin changes are not painful, they can be an indicator of underlying metabolic issues, particularly insulin resistance. Insulin resistance occurs when the body's cells become less responsive to insulin, a hormone that helps regulate blood sugar levels. As a result, the pancreas produces more insulin to try to compensate for the decreased effectiveness, leading to higher than normal insulin levels in the bloodstream. These elevated insulin levels can trigger changes in the skin, including the development of acanthosis nigricans. The exact cause of this skin condition is still not fully understood, but it is believed to be related to the excessive insulin stimulating certain growth factors in the skin, leading to the abnormal skin changes. Acanthosis nigricans is often seen in individuals who are overweight, obese, or have a family history of diabetes, as these factors increase the risk of developing insulin resistance. It is also commonly associated with other conditions such as polycystic ovary syndrome, PCOS, and metabolic syndrome. While the appearance of these dark patches may be the first noticeable sign, it is crucial to understand that acanthosis nigricans is a marker of an underlying metabolic imbalance. If you notice darkened, velvety patches of skin in the aforementioned areas, it may be worth getting your blood sugar levels and insulin sensitivity checked by a healthcare provider. Addressing insulin resistance early is important, as it can help prevent or delay the onset of type 2 diabetes. Lifestyle changes such as improving diet, increasing physical activity, and maintaining a healthy weight are effective strategies for managing insulin resistance and reducing the risk of developing diabetes. In some cases, medication may be prescribed to help regulate insulin levels and improve sensitivity. Early detection and intervention can help reduce the visible skin changes associated with acanthosis nigricans and promote overall health. 9. Increased hunger. Sudden and unexplained hunger is a common symptom of diabetes, particularly when blood sugar levels are poorly controlled. The underlying cause of this increased hunger is the body's inability to use insulin effectively, which is a hallmark of insulin resistance or type 1 diabetes. Insulin is a hormone produced by the pancreas that helps the body's cells absorb glucose from the bloodstream, which is used for energy. When insulin is not functioning properly, whether due to insulin resistance in type 2 diabetes or insufficient insulin production in type 1 diabetes, glucose remains in the bloodstream instead of being absorbed into the cells. As a result, the cells are effectively starved for energy, even though there may be plenty of glucose available in the blood. This cellular energy deficiency signals the body to increase hunger in an attempt to get more fuel. The brain, which relies on glucose as its primary energy source, also responds to the lack of glucose entering cells by triggering the sensation of hunger. As a result, individuals with diabetes may find themselves feeling unusually hungry even immediately after eating. The feeling can be intense and may lead to overeating in an effort to satisfy the body's energy demands. This constant hunger, especially after meals, is particularly concerning because it can lead to poor dietary choices, overeating, and ultimately weight gain. Moreover, even though a person may eat larger amounts of food, the body may not be able to effectively use the energy from the food due to the impaired insulin function, which can perpetuate the cycle of hunger and overeating. This can further contribute to uncontrolled blood sugar levels, making it even more challenging to manage diabetes. If you notice that you are feeling hungrier than usual or experiencing excessive hunger after meals, especially if other symptoms of diabetes, such as increased thirst, frequent urination, or fatigue, are present, it's important to consult with a healthcare provider. Early intervention is key in managing diabetes, as making adjustments to diet, exercise, and medication can help regulate insulin levels, reduce hunger, and improve overall blood sugar control. 10. Unexplained irritability. Irritability is a common but often overlooked symptom in people with diabetes, and it can be directly linked to fluctuations in blood sugar levels. Both high blood sugar, hyperglycemia, and low blood sugar, hypoglycemia, can significantly impact mood and cause irritability or sudden mood swings. These mood changes are a result of how the body and brain respond to shifts in blood glucose levels, which affect the balance of hormones and chemicals in the brain that regulate emotions. When blood sugar levels are too high, the body becomes stressed as it tries to deal with the excess glucose in the bloodstream. This stress can trigger the release of hormones like cortisol, which can increase irritability and make it harder to manage emotions. High blood sugar also affects the brain's ability to function optimally, leading to feelings of fatigue, confusion, or difficulty concentrating, which can amplify feelings of frustration and irritability. On the other hand, low blood sugar levels can cause the brain to become deprived of its primary energy source, glucose. When glucose levels drop too low, the brain struggles to maintain normal cognitive function, leading to symptoms such as confusion, shakiness, dizziness, and irritability. The body reacts to the low glucose levels by releasing stress hormones, like adrenaline, which can further exacerbate feelings of anxiety, frustration, and irritability. People experiencing hypoglycemia may find themselves becoming upset or emotional for no clear reason, and they might have difficulty controlling their reactions to situations. For individuals with diabetes, these mood swings can be challenging to manage, especially if they occur frequently or without clear triggers. They can also impact relationships, work performance, and overall well-being. It's important to recognize that irritability in people with diabetes is not simply a result of personality or stress, but may be a direct consequence of blood sugar imbalances. Monitoring blood sugar levels regularly and managing them through diet, exercise, and medication can help reduce these fluctuations and the emotional effects they cause. If irritability becomes a persistent issue, it's important to discuss it with a healthcare provider, as they may need to adjust treatment or provide additional support for managing blood sugar levels and emotional well-being. 11. Dry, itchy skin. Dry, itchy skin is a common symptom that can occur in individuals with diabetes, particularly when blood sugar levels are not well controlled. One of the key reasons for this skin condition is dehydration, which is often caused by high blood sugar levels. When blood sugar levels are elevated, the kidneys work harder to filter and remove the excess glucose from the bloodstream. This process leads to increased urination, which can cause the body to lose more fluids than usual, leading to dehydration. As a result, the skin loses moisture, which makes it dry, flaky, and more prone to itching. Dehydrated skin can become uncomfortable, and despite regular moisturizing, the dryness may persist or even worsen. This is because simply applying lotion or cream may not address the underlying issue of fluid loss caused by high blood sugar. As the body struggles to maintain normal hydration levels, the skin becomes less able to retain moisture, leading to persistent dryness and discomfort. In some cases, individuals with diabetes may also experience more severe skin conditions, such as cracks, sores, or infections, particularly on the feet or lower legs, as the skin becomes more vulnerable to damage due to its lack of moisture. In addition to dehydration, high blood sugar levels can also affect the blood vessels, reducing circulation to the skin. This can impair the skin's ability to heal and regenerate, further contributing to dryness and irritation. Moreover, individuals with diabetes may be more susceptible to developing other skin issues, such as fungal infections or bacterial infections, which can exacerbate symptoms of dryness and itching. If you find that moisturizing your skin does not provide relief, or if the dryness and itching persist despite your efforts, it may be a sign that your blood sugar levels are not properly managed. It's important to monitor your blood sugar levels regularly and take steps to bring them into a healthy range through lifestyle changes, such as diet and exercise, or by adjusting medications as prescribed by your healthcare provider. Addressing the root cause of dehydration and managing blood sugar levels effectively can help alleviate dry, itchy skin and improve overall skin health. If you continue to experience skin issues, it's also a good idea to consult with a healthcare provider to rule out any underlying complications and receive appropriate treatment. 12. Recurrent infections. Diabetes, particularly when it is not well controlled, can have a significant impact on your immune system, weakening its ability to effectively fight off infections. Under normal circumstances, the immune system works to protect the body from harmful pathogens such as bacteria, viruses, and fungi. However, high blood sugar levels can impair the function of immune cells, making it more difficult for the body to respond to infections. As a result, individuals with diabetes are at a higher risk of developing common infections and may experience these infections more frequently than those without the condition. One of the most common infections associated with diabetes is urinary tract infections, UTIs. High blood sugar levels can lead to increased glucose in the urine, which creates an environment that is conducive to bacterial growth, making the urinary tract more susceptible to infection. People with diabetes are also more prone to developing yeast infections, particularly in warm, moist areas of the body, such as the genital region. The excess sugar in the bloodstream and urine can promote the growth of yeast, leading to recurring infections. Skin infections are another common issue for individuals with diabetes. Poor circulation, a frequent complication of diabetes, can impair the delivery of white blood cells to the skin, reducing the skin's ability to heal and fight off infections. Additionally, high blood sugar can make the skin more vulnerable to cuts, abrasions, and other types of damage, increasing the risk of bacterial infections. Infections such as cellulitis or fungal infections like athlete's foot are also more likely to occur in people with diabetes, especially if blood sugar levels are not well managed. Recurrent infections can be a sign that diabetes is not under control, and that the immune system is struggling to protect the body. These infections may not only be more frequent, but they can also be more severe and take longer to heal. In some cases, uncontrolled diabetes can lead to more serious infections, such as diabetic foot infections, which can lead to complications, if not treated promptly. If you are experiencing recurrent infections, it is essential to seek medical advice to ensure that your blood sugar levels are properly managed. Regular monitoring of blood sugar levels, medication and lifestyle changes such as a balanced diet and regular exercise can help improve your immune function and reduce the risk of infections. In some cases, antibiotics or antifungal treatments may be required to address existing infections, but managing diabetes is the key to preventing future infections and maintaining overall health. Prevention is always better than cure, and taking action early can significantly reduce the risk of developing diabetes or help delay its onset. Adopting healthy lifestyle habits and making informed choices can have a profound impact on maintaining balanced blood sugar levels and promoting overall well-being. Here are a few strategies that can help keep your blood sugar levels in check. Eat a balanced diet. Maintaining a healthy diet is one of the most crucial steps in preventing or managing diabetes. A well-balanced, nutrient-rich diet plays a key role in regulating blood sugar levels and promoting overall health. The foundation of a healthy diet for diabetes prevention involves consuming whole, unprocessed foods that provide essential vitamins, minerals, fiber, and other nutrients. Whole foods such as fruits, vegetables, whole grains, lean proteins, and healthy fats help maintain steady blood glucose levels and contribute to a well-functioning metabolism. These foods are not only rich in nutrients, but also contain fiber, which slows the absorption of sugar into the bloodstream, preventing rapid spikes in blood glucose levels. Fruits and vegetables, for example, are packed with vitamins, antioxidants, and fiber, which are essential for overall health. They are also naturally low in calories, making them an ideal choice for anyone looking to manage their weight and blood sugar levels. Whole grains, such as brown rice, quinoa, oats, and whole wheat bread, are complex carbohydrates that provide a steady source of energy and help regulate blood sugar. Unlike refined grains, whole grains contain the bran and germ, which are rich in fiber and help slow down the digestive process, preventing sudden increases in blood sugar levels after meals. Lean proteins, such as chicken, turkey, fish, eggs, and plant-based options like beans and tofu are essential for maintaining muscle mass and keeping you feeling full longer. Protein helps balance blood sugar levels by preventing rapid rises in glucose after meals. Healthy fats found in sources like avocados, nuts, seeds, olive oil, and fatty fish play a critical role in improving insulin sensitivity and promoting heart health. These fats provide a stable energy source and can help reduce inflammation, which is often associated with insulin resistance. In addition to focusing on nutrient-dense whole foods, it's important to pay attention to the glycemic index (GI) of the foods you consume. The glycemic index measures how quickly a food causes an increase in blood sugar levels. Foods with a low GI, such as non-starchy vegetables, legumes, and most fruits, are absorbed more slowly, causing a gradual rise in blood sugar, which helps keep glucose levels stable. In contrast, foods with a high GI, such as sugary snacks, white bread, and sweetened beverages, lead to rapid spikes in blood glucose levels, which can be harmful over time and contribute to insulin resistance. To further support blood sugar management, it's essential to limit the intake of sugary snacks, refined carbohydrates, and highly processed foods. These types of foods not only have a high glycemic index, but also provide little nutritional value. Regularly consuming sugary and processed foods can lead to weight gain, increased insulin resistance, and higher blood sugar levels, all of which increase the risk of developing diabetes. Instead, aim to replace sugary treats with healthier options, such as fresh fruit or unsweetened yogurt, and choose whole grains over refined options like white bread and pasta. By focusing on a balanced diet that emphasizes whole, nutrient-dense foods, individuals can support healthy blood sugar levels and reduce their risk of developing diabetes. Incorporating a variety of fruits, vegetables, lean proteins, whole grains, and healthy fats into your meals not only helps manage blood glucose, but also provides the essential nutrients needed for overall health and well-being. Exercise regularly. Exercise plays a vital role in managing blood sugar levels and is one of the most effective strategies for preventing and controlling diabetes. Engaging in regular physical activity helps the body become more efficient at using insulin, a hormone that is crucial for regulating blood glucose. When you exercise, your muscles use glucose for energy, and this helps lower blood sugar levels. Regular physical activity enhances insulin sensitivity, meaning that your body needs less insulin to manage blood glucose, which can prevent insulin resistance, a key factor in the development of type 2 diabetes. To gain the full benefits of exercise, in blood sugar management, it's recommended that adults aim for at least 150 minutes of moderate-intensity aerobic exercise per week. This equates to about 30 minutes of exercise 5 days a week. Activities such as brisk walking, cycling, swimming or dancing are excellent choices for moderate-intensity exercise. These activities help elevate your heart rate and increase circulation, which not only burns glucose but also promotes better cardiovascular health, further reducing the risk of diabetes-related complications, such as heart disease. In addition to aerobic exercises, strength training should also be incorporated into your routine. Strength training exercises, such as weightlifting, resistance band exercises, or bodyweight exercises like squats and push-ups, help increase muscle mass. Muscles are more effective at using glucose than fat cells, so building muscle improves your body's ability to utilize glucose for energy. Strength training also boosts metabolism, leading to improved blood sugar control even after the exercise session has ended. Research has shown that combining both aerobic and strength training exercises provides the most comprehensive benefits for blood sugar management and overall health. Regular physical activity also helps with weight management, another critical factor in controlling diabetes. When you maintain a healthy weight, your body becomes more responsive to insulin, and your blood sugar levels are easier to control. Even if you are not overweight, regular exercise can help you avoid gaining excess weight, which is especially important for preventing insulin resistance. Moreover, exercise promotes better circulation, reduces inflammation, and improves heart health, all of which are important for people at risk of developing diabetes. Additionally, exercise can have immediate effects on blood sugar levels. After a workout, your muscles continue to use glucose for several hours, helping lower blood sugar levels and preventing spikes. This is particularly beneficial for people with type 2 diabetes, as it provides an effective way to manage blood sugar levels throughout the day. Overall, incorporating regular exercise into your lifestyle can significantly reduce your risk of developing diabetes and help manage the condition if you've already been diagnosed. By aiming for at least 150 minutes of aerobic activity each week, along with strength training exercises, you can improve insulin sensitivity, enhance glucose metabolism, maintain a healthy weight, and reduce the likelihood of diabetes-related complications. Exercise combined with a balanced diet and healthy lifestyle choices is a powerful tool in preventing and managing diabetes. Maintain a healthy weight. Maintaining a healthy weight is one of the most important factors in reducing the risk of developing type 2 diabetes and managing the condition if already diagnosed. Being overweight, particularly carrying excess fat around the abdomen, is strongly linked to insulin resistance, a condition where the body's cells become less responsive to insulin. Insulin resistance is a key precursor to type 2 diabetes and can lead to higher blood sugar levels over time. This is because when insulin is not as effective, glucose cannot enter the cells efficiently, and as a result, blood sugar levels rise. By maintaining a healthy weight, you can improve your body's ability to use insulin effectively, which helps regulate blood glucose and prevents the progression to type 2 diabetes. Achieving and maintaining a healthy weight can be accomplished through a combination of a balanced, nutritious diet and regular physical activity. A balanced diet that emphasizes whole nutrient-dense foods, such as fruits, vegetables, whole grains, lean proteins, and healthy fats, provides the essential nutrients the body needs while also promoting weight management. Avoiding or limiting processed foods, sugary snacks, and refined carbohydrates is crucial, as these foods can lead to weight gain and cause spikes in blood sugar levels. Regular exercise, particularly a mix of aerobic activity and strength training, helps burn calories, build muscle mass, and improve insulin sensitivity, all of which contribute to healthy weight management. Even modest weight loss can have a significant impact on blood sugar levels and overall health. Research shows that losing just 5 to 10% of your total body weight can lead to noticeable improvements in insulin sensitivity and blood glucose control. For example, if you weigh 200 pounds, losing 10 to 20 pounds can help lower your blood sugar levels and reduce the risk of developing diabetes. This modest weight loss can also lead to other health benefits, including reduced inflammation, improved heart health, and lower blood pressure. Additionally, losing weight can help reduce fat around the abdominal area, which is particularly important because abdominal fat is strongly associated with insulin resistance and increased diabetes risk. Maintaining a healthy weight not only helps regulate blood sugar levels, but also contributes to overall well-being. People who maintain a healthy weight are less likely to develop other health conditions associated with diabetes, such as heart disease, high blood pressure, and high cholesterol. Furthermore, maintaining a healthy weight can improve energy levels, enhance mobility, and reduce the risk of complications that may arise from uncontrolled diabetes, such as nerve damage, kidney disease, and vision problems. In summary, maintaining a healthy weight is a cornerstone of diabetes prevention and management. By following a balanced diet, engaging in regular physical activity, and aiming for even modest weight loss, you can significantly improve insulin sensitivity, reduce the risk of developing type 2 diabetes, and enhance your overall health. The benefits of weight management go beyond just blood sugar control and contribute to a healthier, longer life. Stay hydrated. Staying hydrated is an essential aspect of maintaining overall health, and it plays a particularly important role in regulating blood sugar levels. Proper hydration helps the body function optimally, ensuring that all systems, including those involved in metabolism and glucose control, work effectively. One of the key benefits of staying hydrated is that it helps prevent dehydration, which can otherwise lead to an increase in blood sugar levels. Dehydration occurs when the body loses more fluids than it takes in, causing an imbalance that affects the kidney's ability to filter out excess glucose through urine. As a result, blood sugar levels can rise. Drinking adequate amounts of water helps prevent dehydration and supports the body's ability to manage glucose more efficiently, contributing to better blood sugar control. Water is by far the best choice for hydration. It is calorie-free, hydrating, and does not contribute to blood sugar spikes. Unlike sugary beverages such as sodas, fruit juices, and energy drinks, which contain high amounts of sugar and refined carbohydrates, water helps to maintain stable blood glucose levels. Consuming sugary drinks can cause rapid increases in blood sugar levels because they are absorbed quickly into the bloodstream, triggering insulin responses and contributing to fluctuations in glucose. These fluctuations can be problematic for individuals with diabetes or those at risk of developing the condition, as they make it more difficult to maintain stable blood sugar levels. Additionally, sugary drinks provide little to no nutritional value, making them an unnecessary source of empty calories. In addition to supporting blood sugar regulation, proper hydration also helps other important physiological functions. For example, water aids digestion, supports kidney function, and helps maintain healthy skin. Hydration is also essential for the transport of nutrients and oxygen to cells, which allows the body to perform vital processes more efficiently. Staying hydrated can also reduce feelings of fatigue and improve mental clarity, making it easier to stay active and maintain healthy lifestyle habits, such as regular exercise and healthy eating. For those managing blood sugar levels, it's important to incorporate hydration into daily habits. Aiming to drink at least 8 cups, about 2 liters of water a day, is a general guideline, though individual needs may vary depending on factors such as age, activity level, and climate. For individuals with diabetes, staying hydrated can also help reduce the risk of complications related to dehydration, such as kidney damage, which is a common concern for those with uncontrolled blood sugar levels. Drinking water regularly throughout the day, particularly before meals and after physical activity, can promote better blood sugar management and overall health. In summary, staying hydrated is an easy and effective way to support overall health and blood sugar regulation. Water is the most effective choice for hydration, as it helps prevent dehydration, supports optimal kidney function, and does not cause blood sugar spikes. By choosing water over sugary beverages and making hydration a priority, you can better manage blood sugar levels and reduce the risk of developing or worsening diabetes. Monitor your blood sugar levels. Regular monitoring of blood glucose levels is an essential part of managing your health, particularly if you are at risk for developing diabetes. By keeping track of your blood sugar levels, you can identify fluctuations early, which allows you to take action before the situation worsens. Monitoring gives you the ability to detect rising blood glucose levels and provides valuable insight into how your body responds to different foods, activities, and lifestyle choices. This proactive approach enables you to make adjustments to your diet, exercise routine, or medication regimen in order to keep your blood sugar levels within a healthy range. For individuals who are at risk of diabetes, such as those with a family history of the condition, those who are overweight, or those with a sedentary lifestyle, regular blood sugar monitoring becomes even more crucial. Elevated blood sugar levels over time can lead to the development of type 2 diabetes, so catching any signs of increased glucose levels early can help prevent or delay the onset of the disease. Early detection allows for timely interventions that can improve insulin sensitivity and help you make the necessary lifestyle changes to manage your health more effectively. For individuals diagnosed with prediabetes, monitoring blood sugar levels becomes even more critical. Prediabetes is a condition where blood sugar levels are higher than normal, but not yet high enough to be classified as diabetes. Without intervention, prediabetes can progress to type 2 diabetes, so keeping track of blood glucose levels is a key way to detect any worsening trends and take steps to reverse the condition. Regular monitoring provides real-time data that helps you understand how specific lifestyle factors are influencing your blood sugar levels. This information can be used to guide dietary choices, adjust physical activity, and even make changes to medications if necessary. Blood glucose monitoring can be done at home using a glucometer or continuous glucose monitoring system, which provides immediate feedback on your current blood sugar levels. For those with prediabetes or at risk for diabetes, it's also important to work closely with a healthcare provider to interpret the results and develop a personalized plan of action. Your healthcare provider can offer advice on adjusting lifestyle factors, prescribe medications if necessary, and recommend a frequency for testing that fits your specific needs. In addition to home monitoring, periodic testing at your doctor's office, such as an HbA1c test or fasting blood glucose test, can provide a more comprehensive view of your long-term blood sugar control. The HbA1c test, for example, measures your average blood glucose levels over the past 2 to 3 months, offering insight into your overall blood sugar management. These tests, in combination with daily monitoring, can help guide decisions on lifestyle changes, medications, and other interventions. In summary, monitoring blood sugar levels regularly is a powerful tool for preventing and managing diabetes. Early detection of elevated glucose levels allows for timely interventions that can prevent the progression to full-blown diabetes. For individuals with prediabetes or a family history of diabetes, regular blood sugar monitoring is especially important to identify trends and make necessary adjustments. By staying on top of your blood glucose levels, you can take proactive steps to improve your health and reduce your risk of developing diabetes. Get enough sleep. Getting enough sleep is a critical factor in maintaining overall health and managing blood sugar levels. Sleep plays a vital role in regulating several bodily functions, including metabolism, insulin sensitivity, and glucose regulation. When you don't get enough sleep or experience poor sleep quality, your body's ability to use insulin effectively can be compromised, leading to elevated blood sugar levels. This is particularly important for individuals at risk of diabetes or those who are already managing the condition, chronic sleep deprivation can increase insulin resistance, where the body's cells no longer respond as effectively to insulin, making it harder for glucose to enter the cells for energy. As a result, blood sugar levels can remain elevated, increasing the risk of developing type 2 diabetes over time. To support healthy blood sugar regulation and overall metabolic health, it's recommended to aim for 7 to 9 hours of quality sleep each night. This amount of sleep allows your body to enter the restorative stages of deep sleep, during which important physiological processes, including hormone regulation and cellular repair, take place. A consistent sleep schedule, where you go to bed and wake up at the same time each day, can help regulate your circadian rhythm, ensuring that your body functions optimally. During restful sleep, the body also regulates hormones that influence appetite, blood sugar levels, and stress. For example, lack of sleep can increase the production of cortisol, the stress hormone, which can elevate blood sugar levels. Additionally, inadequate sleep can disrupt the balance of hunger-regulating hormones like ghrelin and leptin, leading to increased hunger and poor food choices, further contributing to blood sugar imbalances. Sleep disturbances, such as sleep apnea, can exacerbate the issue by interfering with the quality of sleep and contributing to insulin resistance. Sleep apnea is a condition where breathing repeatedly stops and starts during sleep, leading to interrupted and fragmented rest. This constant disruption in sleep can stress the body and prevent it from entering the deep, restorative stages of sleep, which are crucial for proper metabolic function. People with untreated sleep apnea are at a higher risk of developing insulin resistance, obesity, and type 2 diabetes. If you suspect you have sleep apnea or any other sleep disorder, it is essential to seek medical advice and treatment, as improving sleep quality can significantly benefit overall health and help maintain stable blood sugar levels. In addition to sleep quality, the sleep environment itself plays an important role in ensuring restorative rest. A cool, dark, and quiet room can promote better sleep, and reducing exposure to electronic devices before bed can help prevent disruptions to your circadian rhythm. Avoiding caffeine or large meals close to bedtime can also improve sleep quality and make it easier to fall and stay asleep throughout the night. Incorporating relaxation techniques, such as deep breathing exercises, meditation, or reading before bed, can help calm the mind and prepare the body for restful sleep. In conclusion, ensuring adequate and high-quality sleep is crucial for maintaining balanced blood sugar levels and supporting overall metabolic health. Sleep deprivation and disturbances can contribute to insulin resistance, increased blood sugar levels, and a higher risk of developing diabetes. By aiming for 7 to 9 hours of quality sleep each night, addressing sleep issues like sleep apnea, and creating a conducive sleep environment, you can significantly improve your ability to regulate blood sugar and reduce the risk of developing diabetes. Prioritizing sleep as part of a healthy lifestyle is an essential step towards supporting your long-term health. Reduce stress. Chronic stress is one of the key factors that can negatively impact overall health, particularly when it comes to blood sugar regulation. When the body is under stress, it activates the fight or flight response, which triggers the release of hormones, including cortisol. Cortisol, often referred to as the stress hormone, is designed to help the body respond to immediate threats by increasing glucose production for quick energy. While this response is useful in short bursts, prolonged or chronic stress can lead to consistently elevated cortisol levels, which can raise blood sugar levels over time. This can cause an imbalance in blood glucose regulation, potentially leading to insulin resistance and increasing the risk of developing type 2 diabetes. Individuals with diabetes or those at risk. Managing stress is crucial to maintaining healthy blood sugar levels. Prolonged periods of high cortisol can interfere with the body's ability to effectively use insulin, leading to elevated blood sugar levels. High stress also tends to encourage unhealthy behaviors, such as overeating, poor food choices, and physical inactivity, all of which further contribute to poor blood sugar control. Therefore, practicing stress management techniques is essential not only for emotional well-being, but also for managing blood sugar levels and preventing the onset of diabetes. There are several effective methods for reducing stress and promoting relaxation. Meditation is one of the most widely used techniques for managing stress. It involves focusing the mind, often through controlled breathing and mindfulness, to calm the nervous system and reduce anxiety. Regular meditation can lower cortisol levels, improve mental clarity, and help the body enter a state of relaxation, contributing to better blood sugar control. Deep breathing exercises, which involve slow and controlled inhalation and exhalation, are another powerful tool for managing stress. These exercises activate the parasympathetic nervous system, also known as the rest and digest system, which helps counteract the effects of stress and lower cortisol levels. Taking a few minutes each day to practice deep breathing can significantly reduce stress and improve both mental and physical health. Yoga is another beneficial practice for stress relief. It combines physical postures, controlled breathing, and mindfulness, offering a holistic approach to relaxation and stress management. Yoga has been shown to reduce cortisol levels, improve insulin sensitivity, and increase overall flexibility and strength. Incorporating yoga into your daily routine, even for just a few minutes, can have lasting positive effects on stress reduction and blood sugar control. Additionally, engaging in hobbies or activities you enjoy can provide an effective outlet for stress. Whether it's reading, gardening, painting, or spending time with loved ones, doing something you find fulfilling and enjoyable can help take your mind off stressors, promote relaxation, and improve your mood. Physical activity, such as walking, swimming, or cycling, is another effective way to reduce stress and improve overall health. Exercise helps release endorphins, which are chemicals in the brain that promote feelings of happiness and well-being. Regular physical activity not only helps lower cortisol levels, but also improves insulin sensitivity, making it easier for the body to regulate blood sugar. Even moderate intensity activities like walking for 30 minutes a day can help manage stress, improve mood, and maintain balanced blood sugar levels. Incorporating relaxation and stress-reducing activities into your daily routine can contribute significantly to overall health and well-being. By taking steps to reduce chronic stress and manage cortisol levels, you can help protect your body from the harmful effects of elevated blood sugar and reduce your risk of developing diabetes. Finding strategies that work best for you and making them a regular part of your lifestyle can lead to improved mental and physical health, better blood sugar control, and a higher quality of life. Quit smoking and limit alcohol. Smoking and excessive alcohol consumption are both harmful habits that can significantly increase the risk of developing type 2 diabetes and negatively impact blood sugar control. When it comes to smoking, the harmful chemicals in tobacco smoke can cause inflammation and oxidative stress in the body, both of which can interfere with insulin function. Smoking has been linked to insulin resistance, a condition where the body's cells become less responsive to insulin, making it harder for the body to regulate blood sugar levels. Over time, this can lead to higher blood sugar levels and an increased risk of developing diabetes. Furthermore, smoking has been associated with other conditions, such as cardiovascular disease, that can further complicate the management of diabetes and increase the likelihood of serious complications, including heart disease, stroke, and kidney problems. In addition to the direct effects on insulin sensitivity, smoking also encourages unhealthy behaviors that contribute to poor blood sugar management. Smokers may be more likely to experience higher levels of stress, which can increase cortisol production and further raise blood sugar levels. Smoking also tends to reduce physical activity levels, as the habit is often associated with lethargy or reduced stamina. This combination of factors can make it more difficult for individuals to maintain a healthy weight, exercise regularly, and control their blood sugar levels. Quitting smoking is one of the most important steps you can take to improve your health, lower the risk of diabetes, and enhance your overall well-being. Similarly, excessive alcohol consumption can also negatively affect blood sugar control. While moderate alcohol intake may not significantly affect blood sugar levels, heavy drinking or binge drinking can cause fluctuations in blood glucose that make it harder to maintain stable levels. Alcohol is processed by the liver, which is also responsible for regulating blood sugar. Drinking too much alcohol can impair the liver's ability to produce glucose, leading to low blood sugar levels, hypoglycemia, especially in individuals who are on insulin or other medications that lower blood sugar. On the other hand, some alcoholic beverages such as sweet cocktails and beer contain high amounts of sugar and carbohydrates, which can lead to a rapid spike in blood glucose levels. This makes it challenging for individuals to maintain balanced blood sugar levels and increases the risk of both hypoglycemia and hyperglycemia. Furthermore, chronic heavy drinking can lead to liver damage, which can further impair the body's ability to regulate blood sugar. This can increase the likelihood of insulin resistance and eventually contribute to the development of type 2 diabetes. Alcohol also tends to promote poor dietary choices, as individuals may be more likely to make unhealthy food decisions after drinking, contributing to weight gain, poor blood sugar control, and other risk factors for diabetes. For those who already have diabetes, alcohol can complicate the management of the condition. Drinking alcohol in excess can interfere with medications, disrupt sleep patterns, and increase the risk of other complications, such as diabetic neuropathy and retinopathy. It is essential for individuals with diabetes to monitor their alcohol consumption closely and speak with a healthcare provider about what is considered safe. Quitting smoking and limiting alcohol intake can significantly improve insulin sensitivity, stabilize blood sugar levels, and reduce the risk of developing diabetes-related complications. By making these changes, individuals can enhance their ability to manage their weight, reduce inflammation, and improve overall health. These lifestyle changes, combined with a healthy diet, regular exercise, and proper medical care, can make a substantial difference in diabetes prevention and management. Making the decision to avoid smoking and limit alcohol consumption is one of the most impactful ways to reduce the risk of diabetes, improve long-term health outcomes, and enhance quality of life. Consult your healthcare provider regularly. Consulting your healthcare provider regularly is a vital step in maintaining your overall health and ensuring early detection of any potential issues with blood sugar regulation, including the risk of developing diabetes. Regular checkups allow for proactive monitoring of your health, providing an opportunity for healthcare professionals to track key indicators like blood glucose levels, weight, and other vital signs. By staying on top of these measurements, your provider can identify any early signs of abnormalities, such as elevated blood sugar, that may indicate prediabetes or an increased risk of developing type 2 diabetes. The sooner any issues are detected, the sooner steps can be taken to prevent or manage the condition, reducing the risk of complications down the line. During your visits, your healthcare provider can recommend and perform specific tests that assess your blood glucose levels, such as the fasting blood sugar test, oral glucose tolerance test, or A1C test. These tests measure how effectively your body is managing blood sugar over time and can provide valuable insights into your health. For example, an A1C test gives a snapshot of your average blood sugar levels over the past 2 to 3 months, helping identify trends that might not be apparent with a one-time measurement. If any of these tests show that your blood sugar is elevated, your doctor may suggest lifestyle modifications, including dietary changes, increased physical activity, or even medications to help you regulate your blood sugar before the condition progresses to diabetes. For individuals with a family history of diabetes, or those who exhibit other risk factors, such as being overweight, sedentary, or having high blood pressure, regular consultations with a healthcare provider become even more important. These factors increase the likelihood of developing type 2 diabetes, and early intervention can help mitigate these risks. By discussing your family medical history and risk factors with your doctor, you and your healthcare provider can work together to create a personalized prevention plan. This plan may include regular screenings for diabetes, lifestyle changes, and guidance on how to reduce risk factors. For instance, your doctor might recommend weight management strategies or provide resources for a balanced diet and exercise program tailored to your needs. Moreover, regular visits to your healthcare provider also offer a chance to address any concerns or symptoms you may be experiencing, related to blood sugar levels such as fatigue, excessive thirst, or unexplained weight loss. These conversations can help ensure that any early signs of diabetes or complications are recognized and addressed promptly. Your doctor can also monitor for common diabetes-related complications, such as nerve damage, kidney issues, or vision problems, allowing for timely interventions that can prevent or manage these conditions before they become severe. By staying in close contact with your healthcare provider, you are taking a proactive approach to your health. Preventing diabetes or managing the condition effectively requires ongoing attention and support. With regular checkups, testing, and open communication with your doctor, you can better understand your risk factors and take the necessary steps to protect your health. Together, you and your healthcare provider can develop a personalized plan that addresses your unique needs, ensures optimal blood sugar control, and enhances your long-term well-being. Final thought. While diabetes may initially seem like an overwhelming condition, it's important to understand that recognizing the early signs and taking proactive steps can significantly improve your ability to manage the condition effectively. The key to tackling diabetes lies in early detection, self-awareness, and lifestyle modifications. By staying vigilant and being mindful of any changes in your body, such as unexplained weight loss, increased thirst, or frequent urination, you can catch potential warning signs before they escalate into more serious complications. This awareness is the first step toward taking control of your health and preventing diabetes from progressing. One of the most effective ways to reduce your risk of developing diabetes is through lifestyle changes. Adopting a balanced, nutrient-rich diet, engaging in regular physical activity, and maintaining a healthy weight are essential strategies for supporting optimal blood sugar regulation. Furthermore, managing stress, staying hydrated, and getting enough sleep are all interconnected factors that contribute to healthy insulin function and overall well-being. These habits may seem small individually, but when combined, they create a powerful foundation for better health and can significantly reduce the likelihood of developing diabetes. Moreover, regular checkups with your healthcare provider play a crucial role in early intervention. Monitoring your blood sugar levels and discussing your health regularly with your doctor can provide invaluable insights into your risk for diabetes. If you're at risk or have been diagnosed with prediabetes, staying in touch with your healthcare provider allows for timely adjustments to your treatment plan, ensuring that you stay on track with your health goals. These proactive measures can delay the onset of diabetes or prevent its progression, helping you maintain a better quality of life for years to come. Ultimately, your health is your most valuable asset, and taking small, consistent steps today can have a profound impact on your future well-being. Every positive change you make, whether it's improving your diet, incorporating more physical activity, or managing stress better, contributes to a healthier lifestyle that not only reduces your risk of diabetes, but also enhances your overall quality of life. Remember, diabetes is a condition that can be managed with the right approach, and it's never too late to begin making changes. Stay proactive about your health, stay informed, and remember that you have the power to take control of your well-being. By prioritizing your health now, you can set yourself up for a future that's full of vitality, energy, and resilience. Stay healthy and stay empowered.